Okay. All right. Good morning, everybody. Today I'll be presenting on evaluating pharmacist preparedness to administer long-acting injectable antiretroviral treatments in the community pharmacy setting. I am a PGY1 community-based pharmacy resident from Acme Pharmacy. For my research, my agenda for the day today is that we'll discuss the background of my research. We will discuss the methodology, so the methods, and specifically some study design. Looking at the results of my research, looking at some discussion points, and then some conclusion. So to start off with some background. According to the Centers of Disease Control and Prevention, the CDC, an estimated 1.1 million people aged 13 and older are living with HIV infection in 2016, and that number has increased over the years. Medication adherence is essential for patients living with HIV, and the initial regimen, according to the Department of Health and Human Services, the DHHS, they recommend the combination therapy. So you need to have 2 nucleoside reverse transcriptase inhibitors, so NRTIs, and 1 integrase strand transfer inhibitor. It's also known as INSTI. So what is a long-acting injectable antiretroviral therapy? LAI-ART, which is what I'll be referring to as throughout my presentation, is a combination of cabotegravir, which is an INSTI, and rilpivirine, which is an NNRTI. Currently, rilpivirine is available in an oral formulation, but this would be injected IM in the gluteus medius every 4 weeks. The studies have shown that they have the same efficacy as the oral medications taken daily for a month. Certain studies right now are undergoing to see if they're efficacious for every 8-week regimens as well, and they have shown positive results. So this injectable might even be given every 8 weeks. It's still not approved. It's pending FDA approval. They have filed for it getting approved with the FDA, and there are some questions with looking at they're making the product, because it is a sterile product, it is an injectable. So once that is cleared up, this product can eventually be FDA approved and available for public. If that does happen, it will increase the potential. It has an increase in adherence for all of our patients living with HIV. It will provide, because it provides similar therapeutic outcomes, such as with the combination oral antiretroviral therapy. So since LAI-ART is a novel therapy, this injectable cannot be injected by the patients. So it's not indicated for self-administration. So then what are our options for our patients? Some of the traditional options include going to an HIV clinic. So the patients can go to the clinic, and then a healthcare professional can administer this injectable. One of the challenges with this option is that there is a barrier with access. A lot of our patients, it's difficult for them to get into a clinic, to have access to healthcare, and specifically these clinics are not widespread in other parts of the country, so it's very hard for our patients to get access. Some of the other options for patients include community pharmacy. Pharmacists in many states currently administer medications. So this can increase access for our patients. Pharmacists have extensive experience with medication administration, especially with antipsychotics. So pharmacists currently inject long-acting antipsychotics for patients in many states who are allowed by law. So this could be something that pharmacists can play a huge role in as well, and increase that access to our patients. Since LAI-ART is a novel therapy, there are many similarities and differences compared to our current medication administration program. VG administration. So as I mentioned before, most of the other med administrations are given in the deltoid, so on the arm. This is given ventrogluteally. So most pharmacists have experience with deltoid injections, and LAI-ART is a VG injection. So that's one of the key differences. Because it is a VG injection, there's also a concern with space limitation and privacy. Patients must be laying down during the administration of the LAI-ART, and for most medication administration, patient can either sit or they can be standing leaning if we're doing a VG injection. For this particular one, in the research studies, they have had the patients lay down. That might change when the medication gets approved, and in their prescribing, in their PI prescribing information, they can say that patients don't have to lay down, but for now, that's where we are in the research. Safety precautions. So LAI-ART is administered for a communicable disease. So compared to other medication administration, so some of the examples could include, since it's an injection, the potential risk for needle sticks. My study objective for this research, for my primary objective, was to evaluate the preparedness of pharmacists who have experience in administering these IM treatments to inject long-acting antiretroviral therapy, so LAI-ART, in a community pharmacy setting. The secondary objective is to identify preferred training methods for our pharmacists who will be injecting these therapies in a community pharmacy setting, to help them be more prepared for this type of service. So going right into the methods of the study, an anonymous online survey was distributed to pharmacists in 17 different states. These 17 states were selected because they have practice laws where they allow pharmacists to administer medications. So on the map here, you can see the 17 states that are starred, and they are listed on the right side. So some states include Pennsylvania, Hawaii, Idaho, California, Arizona, Texas, Virginia. These are some of the states that will allow pharmacists to administer medications, and our pharmacists currently are providing the service in these states. So research was approved by the Temple University Institutional Review Board, so the IRB. Pre-testing of the survey was done in New Jersey pharmacists. This was particularly picked because in the state of New Jersey, pharmacists cannot administer medications. And the feedback was incorporated into the final survey. Their feedback was basically on the wording of the survey, if the questions made sense to them, if they were confusing or vague. All of those feedback were incorporated to create the final survey, which is sent to the 17 states that were predetermined. Final survey consisted of 23 questions, and data was collected from January 2020 till February 2020. So about they weren't full 2 months. They were about 3 to 4 weeks of data collection. At the end, raffle for the participants, there were 10 gift cards that were worth $100 each that were raffled for all the participants that participated in the survey. This was an incentive for our participants to increase in the survey, and then we can get a good amount of survey results. For methods, for the inclusion criteria for the survey, pharmacists must have an active license in the state that they are practicing. They have to have the authorization to administer injectable medications if their state requires an additional license. Experience with administering at least one IM treatment other than immunizations. So only those pharmacists who had any experience with injecting these long-acting injectables were surveyed. Some of the statistical tests done on the survey and the results were descriptive statistics, analysis of variance with multiple comparisons using Bonferroni correction, and 2 sample t-tests were also completed, and p-value less than 0.05 was considered significant. Looking at the survey instrument that was sent out electronically, it consisted of multiple choice questions, so yes or no type questions, and Likert scale questions, so which basically means from strongly agree to strongly disagree with a statement. The survey question addressed following concerns. So looking at injection techniques, safety concerns such as needle sticks, workflow and store characteristics and resources, and preferred training methods for administering medication in the gluteus medius, also referred to as ventrogluteal VG. The primary endpoints for the survey included the questions that our community pharmacists should administer LAI-ART. I'm comfortable administering IM ventrogluteal therapy, sufficient space at my pharmacy to administer IM VG therapy such as LAI-ART, if there's appropriate equipment, so chairs, tables at my pharmacy to administer this type of therapy. Since we know that there are some concerns with privacy, and one of the questions included, does the pharmacy have a private area to provide this service for our patients? And the last question that was asked to the pharmacist was their concern with the potential safety issues, such as needle sticks while administering LAI-ART therapy in the community setting. Looking at the survey questions for the secondary endpoint, this looked at the training materials. What type of training materials did the pharmacist felt that were needed to feel more prepared for this type of service? So LAI-ART training materials should be delivered through these different mediums. So they want written handout with diagrams and stepwise protocol, a video, a live webinar, live in-session training for pharmacists to discuss and train them on how to give this injection. Some of the other questions in the survey included demographic questions, so looking at education for the pharmacist, if they have any advanced credentials, how many years of practice have they had, the number of IM injection they have administered, so IM and ventrogluteal, how many of them have they administered in their time of practice. So going over to the results section of the study, when the survey was done, it was sent, like I mentioned, in about 17 different states with all the different pharmacists. All those pharmacists were Albertsons company pharmacists, and a total of 27 participants had completed the survey. Of those, only 71 participants met the inclusion criteria. So our inclusion criteria had 3 points. They had to have active pharmacist license in where they practice. They have to have the authorization to administer injectables. And the third one was they have to have at least one they had to at least administer one IM therapy in their years of practice to take the survey. So 71 of those participants met all those 3 criteria, and then they went ahead and completed that survey. And each participant that met the inclusion criteria was able to finish the entire survey and answer each question. Looking at the results for the primary objective, it was to evaluate the preparedness of pharmacists who have experience administering IM treatment, so any intramuscular treatment to inject the long-acting antiretroviral therapy in a community pharmacy setting. Some of the results included that 57.3% of the pharmacists felt that they were prepared to administer this new therapy in a community pharmacy setting based on their experience. 67.6% of pharmacists had about 10 to 30 years of work experience, and they felt prepared to administer long-acting antiretroviral therapy. Patient care pharmacists and residents felt more prepared. So for our company at ACME, we have pharmacists we have pharmacy managers, we have staff pharmacists, we also have patient care pharmacists. These pharmacists they have designated time away from the workflow to work on different clinical services, such as medication administration, doing medication therapy management, and residents such as myself throughout the company across all these different states. And they felt more prepared compared to the pharmacy managers and staff pharmacists to administer this type of a service. And the p-value for this specific endpoint is 0.047. So it is statistically significant, as it is below 0.05. 69.7% of pharmacists strongly agreed that more training is needed to administer an IM-VG therapy. And this was true across all different pharmacists, the pharmacy managers, this includes staff pharmacists, this includes patient care pharmacists, also residents. So this percent of pharmacists felt that they need additional training. And then looking at what kind of training, which is what the secondary endpoint was, to identify preferred training methods for our pharmacists injecting LAI-ART in a community pharmacy setting. So 84.5% of our pharmacists, they preferred the live training session. So if there were 4 options that were given to the participants, if they preferred written materials, if they preferred a video, or if they preferred a live webinar or a live in-session training. And majority of the pharmacists prefer the live in-session training to have to go over and discuss this type of service, as this is a new therapy. As I mentioned in the beginning of the presentation, this is the first injection available for treating HIV, whereas all the other therapies have been oral therapies. So again, looking at the primary endpoint, which is the pharmacist's preparedness to administer LAI-ART. On this graph, on the left side, you can see the number of the percentage of the participants. On the x-axis, you'll see different questions that we had mentioned earlier that were asked to our pharmacist. So the first question about community pharmacists should administer LAI-ART, that statement, how many participants agree to disagree, and we can see from, so the colors go from the darkest blue to lightest, with being strongly agree to strongly disagree. So the top part, the top parts are all the percentages for participants who strongly agreed with those statements. So we can see about 35.2% strongly agree that community pharmacists should administer this type of a therapy in a community setting. About 20% of the pharmacists felt that they were comfortable with administering this IM therapy. They strongly agreed to that. About 40% of the pharmacists strongly agreed to having sufficient space at the pharmacy to administer this type of a novel therapy. About 40% of pharmacists also felt that they had appropriate equipment, so chairs, tables, and then about having private area, same thing, 42% felt that they were strongly agreed that they did have that area in their pharmacy and those resources to provide the service. And there were only about 15% of pharmacists who felt that they had concerns about safety, such as having needle sticks while administering LAI-ART, similar to other injections that we provide to our patients. Looking at the chart for the preferred training methods, again, the secondary endpoint, this is a graph to show how many participants strongly agreed to disagreed with the written handout, having a video, live webinar, or live in-person training. And again, on the left side, on the y-axis, is the percentage of participants that agreed or disagreed with this statement. So as we can see, majoritively of participants agreed that they would like a live in-session training. And the second highest were videos. So a lot of pharmacists also felt that the preferred training method would be through the medium of a video as well. Looking at some of the demographics for the study's participants, as we mentioned, there were 71 participants who participated in this survey and completed the whole survey from start to finish. Some of the characteristics, so looking at their education, about 16 pharmacists had their bachelor's in pharmacy. A majority of pharmacists, about 55, had their PharmD degree. There were some pharmacists who had different advanced credentialing, which can be obtained post graduation from their respective colleges. So AAHIVP, which is American Academy of HIV Pharmacists, about 4 pharmacists had that credential. Some of the other credentials included American Academy of HIV Expert, board certified ambulatory care pharmacist, board certified pharmacotherapy specialist. These were some of the advanced credentialing that our participants had that took the survey. Some of the different positions in the company that the participants answered were pharmacists in charge, which is also the pharmacy managers, staff pharmacists, floater pharmacists. There were none per diem pharmacists who had completed the survey, and then other. So most of the other pharmacists were our patient care pharmacists, our residents. Those were in the other category. Looking at work experience, so these pharmacists who participated in the survey, majority of the pharmacists had either less than 5 years of experience or 5 to 15 years of experience. And there were about 16 pharmacists who had worked greater than 25 years. Looking at postgraduate training, so some of our participants had 1 year of residency that they had completed after graduating college, and we did have one participant who did complete a PhD. Looking at the amount of IM deltoid injections that were administered, majority of the participants had administered less than 10 of these IM injections during their work experience. About greater than 50 would be about 15 participants who had varied variety of experience and extensive experience as well. Looking at the amount of IM-VG injections other than vaccines, again, the majority of pharmacists answered that they have administered less than 10 of these injections in their practice settings, and about 3 of them had injected about greater than 50 of these injections that are ventrogluteal, which are not as common as the deltoid injection. Going further through the discussion of the research now, majority of the pharmacists agreed that community pharmacists should administer LAI-ART in the community setting. As we saw in the results from the survey, these participants and these pharmacists feel that they have experience with medication administration in the past, and they can administer this new novel therapy for their patients as well. A lot of our pharmacists also had postgraduate training and also had advanced training after graduation, which could be a factor in these pharmacists feeling ready to administer these new therapies in their setting right now. About a third of the pharmacists expressed the need of additional training. This was almost a little expected, as this is a brand new therapy. It's very novel. It's very current. So our pharmacists felt that they do need some additional training before they can provide this clinical service for our patients living with HIV. Staff pharmacists and pharmacy managers mostly express the need, higher need compared to our patient care pharmacists and residents. And again, this could be because our patient care pharmacists and our residents have dedicated time for patient care services away from their workflow. So again, doing the MTM, doing medication therapy management, doing medication administration for antipsychotics. They do have a little bit of more of an experience, so that could be a reason why the other pharmacists expressed more of a need to have more training. The statistical significance for the patient care pharmacists and residents feeling more prepared was a p-value of 0.047, as mentioned in the results section. This is statistically significant, and looking at its clinical significance, like I mentioned, because of the high experience that they've had with these services, that's why they're more likely to feel more comfortable with this type of a clinical service getting added on. And also something interesting to look from this research is to look at pharmacists who have about 10 to 30 years of work experience felt that they were most prepared to give this therapy in a community setting. So more numbers of years of practice maybe led to increased preparedness compared to pharmacists who have had maybe less than 5 years of work experience. They just might have not had so many instances where they have administered or any other medications in their practice. But pharmacists who have had multiple years of experience showed that they had an increased level of preparedness to administer this therapy in a community setting. Overall, most pharmacists, as I mentioned earlier, prefer the live session for training. And one of the reasons for this is because it's more interactive, since giving a VG injection, it's more difficult to look in a video and to understand, but then it gets easier as you practically do it in a practical setting. Of course, it's difficult right now with everything going on and with social distancing, but once that is taken care of and once we return back to a state of normalcy, this would be the preferred training session for our pharmacists, as it is more interactive and we want them to be more prepared when this therapy gets approved for our patients. Some of the limitations for this study, so there was a short duration of data collection. As I mentioned, the data was only collected for about 3 weeks. If the data collection time was a little longer, we could, if it was extended, we actually would have seen an increase in our survey responses, possibly. Because of the low sample size, and of course all the pharmacists that were surveyed in all these 17 states were from a single company, the external validity is not as high. So for the future studies, they should look at pharmacists in multiple different pharmacy chains, or also looking at chain pharmacies and also independent pharmacies, and see if these pharmacists are prepared to give LAI-ART therapy in a community setting. There was no detection if these medications were administered in their current practice setting or in a different practice setting. So these pharmacists that participated in the survey, we weren't able to detect if they had administered these injections as part of being a community pharmacy, or if they had maybe a different role in their career previously where they were administering these medications. So currently they're all community pharmacists, but we did not detect if what their past roles have been. So that is one of the limitations of the study as well. In looking ahead in the future, some of the studies should be looking at different barriers, as we know that community pharmacists are prepared to give this therapy through the study. Future studies should look at maybe possible barriers that these pharmacists may feel in administering this type of a service in a community setting. With conclusion, Most community pharmacists are prepared to administer LAI-ART in a community pharmacy setting when it gets approved, and additional training to administer IM-VG injection particularly should utilize live training sessions for our pharmacists to be best prepared to have this clinical service for our patients living with HIV. And with that, I would like to have some acknowledgements. Dr. Amy Min from Temple University, Dr. Anisha Grover from Temple University, Patty Mellison, my residency director, Gabriela Pepe, my residency coordinator, Bethany Abrahams, another one of my residency coordinator, Dr. Hawik Zhao. He's a professor at Temple University who helped with statistical analysis, specifically the top tier group, which is a PGY1 community-based residents and preceptors of training outpatient pharmacist techniques in evidence-based research from the University of Pittsburgh. And I would also like to acknowledge that I did receive the APHA Foundation for Incentive grant funding for this research. And they were utilized, as I mentioned, to give gift cards to our raffle winners who participated in the survey. And with that, I would like to thank everybody for their time. And I open the floor to any questions. So what questions do you have for me?
Thank you, Dr. Soni, for your presentation. This is really exciting to see how far, one, with long-acting injectables, how far the HIV has evolved in terms of medication. I think it's great to be able to have that for those individuals who struggle with adherence, but also having the opportunity to choose whether I could see my doctor or go to a local pharmacy to get the injections that way if they have access to it. But it's also good to know also that you're looking at what trainings are needed for such pharmacists, and are they comfortable, and what training do they need to begin to prepare them for what's to come in the future as we move towards, as the trend moves towards the injectable. So thank you for your presentation. We have 2 questions. I'm going to call my intern, Victoria, to begin to manage those questions.
Hi, thank you. Yeah. So the first question is, given that patients may not self-administer the medication, will there be options for patients who receive home delivery for their prescriptions? In some instances, these patients are physically incapable of independently picking up prescriptions.
Right, so that is definitely a concern. Thank you for that question. So yes, currently the way that this therapy stands, it is not indicated for our patients to self-administer, such as, for example, insulin. Our patients can self-administer insulin. So yes, if some of our patients, if they cannot go to a facility, for example, go to an HIV clinic, that's a barrier for them to get this medication. But from their pharmacy standpoint, yes, pharmacists can possibly deliver the medication to the patient, but of course, being in a community pharmacy setting, the patients would have to come to the pharmacy to actually get it administered. With that being said, there are certain groups that do, I particularly work in an AM care site that we do home visits for. So there are certain pharmacists that work with our special needs patients who need home visits. Either they're bedbound or they cannot physically, they have some type of a disability that they cannot come to the location or clinics or pharmacies. So yes, that would be the route for those patients if they cannot access a physical location where a healthcare professional might be. That would be the access, that would be the next step to have it administered at home during a home visit. Of course, this is all pending approval, and once the drug is approved, there will be some of these questions will also be answered in where it needs to be stored and how it needs to be stored, how it needs to be transported, and things like that. That's still pending.
Great, thank you. So the next question is, from an accessibility standpoint in a typical community pharmacy, do you think this medication will be available in a general retail pharmacy, or do you predict this will be a specialty medication?
Absolutely. So thank you for that question. So this will be a specialty medication. So if you go to a retail pharmacy such as Acme, we do medication administration in the state of Pennsylvania, but we might not have all these injections on our shelves in a regular community pharmacy. But if the patient has a prescription, we have a specialty department in our company that we can contact with and get our medications from them on the basis of what patient need, and get those medications in and administer. And I currently do this service for my patients who I give Invega to, Abilify. So all those injections we special order. We partner with our specialty care, which is accredited, and we get those medications from them and administer it in the community pharmacy setting.
Awesome, thank you. So as of now, that's all the questions.
Oh, that's fine. I can give them a couple more minutes. If anybody else has any questions, comments, suggestions, I'd love to hear them. Again, a big thank you to the Fight Group for putting this together and giving me an opportunity to present. I definitely want to show my gratitude for that. And yeah, any other questions?
You're quite welcome, Dr. Soni. We enjoyed having you, and thank you for submitting your research study and willingness to share with us some of your findings. And so right now, if anyone has any other questions, please feel free to use the Q&A box below to ask any questions you may have.
And we have another one. So I want to ask, I don't know if I missed this, but when can we expect LAI-ART to be available?
Absolutely. So currently, LAI-ART therapy they actually submitted to the FDA. So Viv Pharmaceuticals is a company that is researching this medication. They submitted to the FDA in the end of last year, so 2019. There are some questions with the production. So of course, this is a sterile, it's an injection, so it has to be done in a sterile environment. So the FDA had some questions about manufacturing, looking at production and things like that. So the company is still working to answer those questions to the FDA and answer those concerns, ensuring that the medication is safe for our patients to use. So currently it is in their phase 3 trials, of course, showing very positive, the results are in a very positive direction, showing efficacy and safety for the medication. So the expectation was that this would be approved very soon, but with everything going on right now, it might get delayed because of the pandemic that we're in. We're not gonna see this anytime, maybe the end of the year of this year, that they are saying that the company will reach back and answer the questions from the FDA and hopefully get this product approved. And of course, there is a lag time from FDA approves it to manufacturing it and then actually having it available for our patients and to the patient, basically. So there might be a lag time there as well, but I would say not sooner than the end of the year, just with everything going on and everything getting pushed back.
Great, thank you. So we do have a few more questions. So how can we ensure adherence so that patients keep coming back to the pharmacy?
Absolutely, that's very important. That's a really good question, and that's one of the potential struggles that we struggle with our patients on potential medication adherence, right? Yes, this is once a month versus them taking a pill every day. So yes, that there's a potential that adherence will be increased, but what if they miss that appointment? And that has happened, right? Some of the patients may not come in regularly. A lot of different techniques or tools that us pharmacists on our standpoint that we use, we do our our reminder appointments. We would have our we set up appointments well in advance, and then also give our patients a call a few days before the appointment to ensure that they will be coming in for the appointment, and also at the end of the day really wanting to get our patients involved in that care, which is why it's very difficult, because some patients just might not be as motivational in their health, and sometimes that's challenging. And some of the techniques that we have used is to do those calls, but also working in a clinic standpoint. Some of the providers will not refill their medications, so unless they come into the clinic for a visit, so they sometimes hold that patient accountable for their health and for the medication refills that they need to come into the clinic, get their lab work done, and any additional services that they might need in order to ensure that the patient is appropriately using the therapy and there are no side effects and such profiles. So it's very difficult, but those are some of the tools that we can use. And at the end of the day, I think the biggest thing to do is to really get our patients involved in their care. And I think that will increase their motivation, and that will help them keep these appointments and help them keep coming back to the pharmacy to get this medication.
Sorry. Yes, I was. Sorry. All right. So next one is there something that home nurses or people other than pharmacists and HIV-specific clinics would be able to administer?
Right, so this would be the same medication. This is the first LAI-ART, so this is the first injection available for patients living with HIV, and this will be, when it gets approved, available in many different settings. So in a clinic setting, so for nurses to administer, for physicians to administer, for pharmacists to administer, so all the healthcare providers will be able to administer this medication. I specifically looked at it being available in a community setting, but yes, nurses and other professionals can of course administer this this therapy in the practice site that that they practice in.
Thank you. So next question, and forgive me if I mispronounce this. Cabotegravir is also evaluated for PrEP for HIV prevention. Was this taken into consideration during your research? How could you see any additional barriers or concerns for in-house injection for prevention versus treatment?
Right, so absolutely. Cabotegravir is a new, it's a new molecule. Like I mentioned, that the rilpivirine, we already have an oral formulation for, which is converted to an injectable. Cabotegravir is a brand new molecule that is awaiting FDA approval. So yes, it is currently being studied for HIV PrEP, so HIV prevention, and it will be part of the LAI-ART for treatment with the rilpivirine and that combination. So cabotegravir itself is looking at getting approval for both those indications. And yes, that is again something to look into as well for future studies, to see what kind of different barriers will be seen with that. With PrEP, of course, again, adherence is key. It's very important that our patients who are at high risk for getting the HIV infection, that they do get their PrEP treatments done, and then they're adherent to it, so they ensure that it's prevention and it doesn't lead to treatment. It doesn't lead them to getting the infection. So biggest barriers there that I can foresee with PrEP treatment will again be adherence. Adherence is key, and I think being the injections versus the pill taking every day, we should see an increase in adherence and maybe some decrease in barriers, and hopefully access as well.
Awesome, thank you. So next question, will MTM be available for billing purposes for the injecting/counseling process?
Absolutely, yes. So those are some of the questions that are that we can't foresee, but looking at our current clinical services, so pharmacists can bill for getting the administration fees for the long-acting injectables that they are administering. So on basis of that, we can maybe foresee or predict that pharmacists will be able to bill for this service as well for the medication administration portion of it when they do administer it in either a clinic setting or in a community setting.
Thank you.
Absolutely, loving the questions. Thank you everybody for being so engaged.
Thank you.
And that is the end of our questions thus far. So Dr. Sonny, again, thank you for sharing your knowledge. This was a very informative presentation and something definitely to think about when you have consumers may ask questions about such treatment, and when further information is presented around possible access to pharmacies to have such medications injected, having that information ready for them to learn more about that process as well. So I look forward to seeing how this evolves and when such things could actually happen in community pharmacies.
Absolutely. Thank you, everybody. Stay safe and take care. Bye-bye.
And as a reminder, guys, before you log off, there is a survey that you'll be prompted to complete a survey at the end of this webinar. So please fill out your survey, give us some feedback about today's presentation and your thoughts, and so we can share that with Dr. Sonny. If you don't have any other questions, then someone says, thank you for the training, Dr. Sonny. Thank
you. Yep. Pleasure's all mine. Take care.
If there isn't anything else, we will end today's webinar today. So everyone have a great day. Take care.